help you with the time management competency in MA 140. As medical assistants, we have many duties that we're responsible for throughout the day, both clinical and administrative. So we need to multitask and really manage our time well throughout the day and make sure we do the most important things first, even though all of the tasks we're assigned are important. So for instance, say that you have to do an EKG, pull charts for the next day, file labs inside of patients' charts, print the schedule for the day, and check on the collections report. Well, there's certain items that you would do before others. For instance, the first thing out of that task list would be to print today's schedule. We need that schedule before we can start seeing patients. So it would make sense to make our first priority out of those 5 tasks to print the schedule. The second thing we would want to do the EKG. As soon as we have a patient in a room and that needs a procedure, that needs our attention. So anything the provider needs or a patient needs, we want to kind of bump up on that list of duties for the day. The third item out of the items listed would be to file labs in a patient's chart. It's very important to get those in the chart as soon as possible so that the provider has them when the patient is seen. So the patient's not waiting on us, our schedule is already printed, so it would make sense next to file those labs in a patient's chart. The next thing we want to do is get those charts pulled for the next day. Yes, that is an important task, but it can wait until later in the day after the provider's not waiting on us or a patient's not waiting on us, and all the other items are done first. And then the last thing really throughout that day would be check on collection reports. Those collection reports do need to be done periodically, so again, all of those duties need to be done in a day, but there is kind of a time frame or an order of importance that we want to prioritize those tasks. Another list of tasks that you might come across are things like emptying the trash. Now that's going to be something you do at the very end of the day, right? You're not going to empty the trash before you've used the trash cans or patients have thrown things in. So emptying the trash would be an important task to do at the end of the day. If you have a patient standing at the window, that's going to be one of your number one priorities, is to greet that patient. We don't want to go, maybe answer a phone call or possibly send reminder cards before we greet a patient at the window. Other things that you might do throughout the day is answer a call that's on hold. We want to get to that as soon as possible. Another thing you might do is call for insurance verification. So again, that's something we definitely want to do throughout the day before the day is over, but it can be kind of done a little bit later in the day. Same thing with maybe sending reminder cards for other appointments. That too is a lower priority task. No one or nothing is waiting on us to do that task. Those are just going to go out the next day in the mail. So as long as we have that completed before we leave for the day, that would be a good item to do, kind of lower the second half of our task list for the day. So I hope that helps give you some idea as to what items to prioritize high, what items to prioritize medium, and which ones are lower priority. Again, do keep in mind medical assistants are multitasking throughout the entire day. All of these items are important, and we have a list of duties that need to be done before the day is closed. We just need to make sure that we are using our critical thinking, identifying what's more important than others.